Skin conditions in babies and kids may include rashes, hives, warts, acne, birthmarks, and more. These conditions may be caused by dermatitis, viral infections, bacterial infections, fungal infections, or other diseases. Treatment varies from anti-itch creams to pain relievers to antibiotics, depending on the condition. What are skin conditions in children? Skin conditions in kids may include hives, warts, acne, birthmarks, and all sorts of rashes. What are the different types of skin rashes in children? Many different types of rashes can affect your child. Dermatitis, viral infections, bacterial infections, fungal infections, and many other conditions may cause rashes. 1. Dermatitis. These conditions may cause red rashes, itchiness, and dry skin on your child and happen at any age. Types of dermatitis include diaper rash, cradle cap, eczema, and contact dermatitis. 2. Diaper rash. Diaper rash occurs when moisture in your baby's diaper area causes irritation or growth of fungi or bacteria that normally live in small amounts on the skin. To prevent or treat diaper rash, keep your baby's diaper area clean and dry by changing diapers frequently. When changing your child's diaper. 3. Eczema. Eczema makes your child's skin itchy and then it gets red, irritated, and dry. Differences in your child's skin barrier compared to normal, healthy skin and an immune system that tends toward allergies cause eczema. 4. Contact dermatitis can occur when kids have a reaction to an allergen or an irritant. Allergens may include poison ivy or medications. Irritants may include perfumes, soaps, cleaners, and paints. Contact dermatitis causes an itchy skin rash that is sometimes also painful. 5. Viral infections. Viral rashes in babies, toddlers, and kids are caused by a variety of different viruses. These infections include fifth disease, Rosiola, chickenpox, measles, Rubella, Molluscum contagiosum, and hand, foot, and mouth disease. 6. Fifth disease. Fifth disease is also called slapped cheek slap face disease. It causes a bright red rash on your child's cheeks. A specific virus, parvovirus B19, causes fifth disease. Your child may have a fever and other nonspecific symptoms. After a few days, the facial rash will fade, but then pink patches may develop in a lacy pattern on your child's arms and legs. 7. Rosiola. Human herpes virus 6 causes rosiola. With rosiola, your baby will suddenly develop a high fever that can last up to a week. Once the fever breaks, a slightly raised, spotty pink rash may appear on your baby's chest or stomach. The rash may spread to your baby's upper arms and neck, and then it will fade after about 24 hours. 8. Chickenpox. Varicella zoster virus causes chickenpox. Chickenpox generally causes a rash on your child's face, chest, and back first, but it may travel to their entire body. The rash turns into itchy, fluid-filled blisters, then blisters turn into scabs. Chickenpox usually goes away on its own in 1 to 2 weeks. 9. Measles. Measles is very contagious and prevented by the measles vaccine or MMR vaccine. It causes a rash that starts on your child's face. It's typically seen behind the ears or around your child's mouth. Then it moves down over their body. The rash starts as flat red spots, but then smaller raised white spots may appear on top of the red spots. The spots may join together as it moves down your child's body. Measles has to run its course. It will go away within about 2 weeks unless complications develop. 10. Rubella. It can look similar but is caused by a different virus than measles. Rubella causes a red or pink rash that starts on your baby's face and neck. The rash then spreads to other parts of your baby's body and lasts about 3 days unless complications develop. The rash then spreads to other parts of your baby's body and lasts about 3 days unless complications develop. Your baby may have a fever, cough, or runny nose before the rash appears. Rubella has to run its course. 11. Molluscum contagiosum. Molluscum contagiosum has raised bumps on your child's skin. The bumps are usually flesh-colored, pink or pearly white with indentations in the center. The bumps will show up on your child's face, chest, stomach, arms, and legs. They're painless, but they may not go away for several months or years. Molluscum contagiosum will eventually go away on its own without treatment. 12. Hand, foot, and mouth disease. The disease causes a red rash to develop around your toddler's mouth and on the palms of their hands and soles of their feet. It may also affect other areas. The rash may turn into bumps or blisters on your baby's skin and in their mouth, and they can be very painful. Hand, foot, and mouth disease usually goes away on its own within 1 to 2 weeks. Bacterial infections. Types of baby rashes may also include bacterial infections such as scarlet fever and impetigo. 1. Scarlet fever. Scarlet fever usually starts with a fever, sore throat, and headache, but the key symptom is a raised, red rash on your child's neck and upper chest. The rash may then spread to other areas of your child's body. Your child's face may be red with a pale area left around their mouth. The rash feels rough like sandpaper and may look like your child has a sunburn. Treatment. Treatment for impetigo usually includes antibiotics that may be oral or put directly onto the skin. Fungal infections. Common skin rashes seen in babies, toddlers, and children can also include fungal infections such as ringworm. 1. Ringworm. It causes round or oval patches to develop on your child's skin. The patches have smooth centers and red, scaly borders and may not look like rings right away, but you'll notice the rings when they get bigger. The patches may be itchy and painful and may become puffy and inflamed. Treatment. You can treat your child's ringworm with antifungal medicines. What is a teething rash? When your baby's teeth are starting to come in, they may drool a lot more than usual. Drool can irritate your baby's skin. This can cause a harmless rash known as a teething rash. The rash causes tiny, red raised bumps on your baby's face, neck, or chest. Hives. Hives are itchy pink, pale, or red bumps on your baby's skin. They may be small, slightly raised spots or large welts of different shapes. Sometimes hives are ring-shaped or look like targets. The rings may have normal-looking skin in the center, or they may look pale, purple, or blue. Hives can appear anywhere on your child's body and may flatten out over several hours. But new bumps can keep showing up for days or weeks. What is baby acne? Little white bumps and pink pimples to appear on your baby's face, including their forehead, cheeks, eyelids, and chin. An inflammatory reaction to yeast on your baby's skin may cause baby acne. What are birthmarks in children? 1. Red birthmarks. Commonly found on your baby's face, scalp, back, or chest. They're made up of small, closely packed blood vessels. Strawberry hemangiomas usually fade or go away as your child ages. 2. Cavernous hemangiomas. They're deeper in your child's skin and often darker in color. They look like reddish-blue spongy masses of tissue filled with blood. Cavernous hemangiomas usually go away on their own as your child ages. Port wine stains. Port wine stains are flat, reddish-purple birthmarks. They're made up of dilated blood capillaries. They're commonly seen on your child's face and they vary in size. Port wine stains are permanent, without treatment. Salmon patches. Salmon patches are small blood vessels that are visible through your baby's skin. They are frequently seen on your baby's forehead, eyelids, upper lips, between their eyebrows, and on the back of their neck. Salmon patches fade as your baby grows. Pigmented birthmarks. Mongolian spots. These birthmarks are typically bluish and may look like bruises. They're often found on your baby's buttocks and/or lower back. Sometimes they appear on your baby's chest, back, or arms. Mongolian spots are seen most often in babies with darker skin. Pigmented nevvy. Pigmented nevvy are also called moles. Moles are growths on your baby's skin that typically are flesh-colored, brown, or black. Moles can appear anywhere on your baby's skin. Your baby may have one mole or several in a group. Congenital nevvy. Congenital nevvy are moles that your baby was born with. These moles have a slightly increased risk of becoming skin cancer. Larger congenital nevvy have a greater risk than smaller congenital nevvy do. Your baby's healthcare provider should examine all congenital nevvy and may refer you to dermatology. Caffe olay spots. They're usually oval-shaped. They commonly appear at birth but might develop in the first few years of your child's life. Caffe au lait spots are usually harmless, but if your child has many caffe au lait spots, or if they are large, consult their healthcare provider. It may indicate a serious genetic